Okay, Miss, my name's Catherine. I'm an EMT, and I'm going to be helping you. Can you tell me your name?
I'm Kate.
Okay, Kate, I'm going to be taking your vitals first.
Okay.
So I'm going to reach out and I'm going to hold your wrist, and I'm looking for your pulse here.
For conscious patients, take a pulse with the radial artery. Count the number of heartbeats in 30 seconds and multiply by 2 to get the beats per minute. A normal adult should have a heart rate of 60 to 100 beats per minute, though some athletes may have a lower resting heart rate. After finding the pulse, count the number of breaths the patient takes in 30 seconds and multiply by 2. If possible, keep your fingers on their wrist as though still measuring their pulse. When a person becomes aware of their breathing, its rhythm changes, so it's best to avoid letting them know when you're observing their breathing. A normal adult breathes 12 to 20 times per minute. If observing the chest rise and fall proves difficult, resting a hand on the patient's shoulder can sometimes help you feel their breaths.
I'm going to be listening to your heart and your lungs. Okay. Okay, big deep breath for me. And out. Again. And out. Breathe deep. And out.
Clear lungs will sound mostly
In
silent, so hearing
and out.
adventitious lung sounds is a good indication of respiratory problems.
And out.
It's important to listen to the top and bottom of each lung, as some sounds will only be audible in certain parts of the lung. The blood pressure cuff should be placed on the upper arm with the artery marking approximately over the brachial artery. It should wrap around the arm 1 to 1.5 times. The blood pressure cuff should be snug but not uncomfortably tight. To take an auscultated blood pressure, place the end of the stethoscope on the inside of the arm distal to the cuff. Tighten the air release valve on the inflation bulb by rotating it clockwise. Pump up the cuff until you can no longer hear or feel a pulse, and begin to slowly release pressure by opening the air release valve. Keep track of the pressure readings on the gauge the first and last time you hear the patient's pulse. Typically, blood pressure is written as two numbers, such as 120/80. The highest number, or systolic blood pressure, is the pressure reading when you first hear the patient's heartbeat through the stethoscope. The lower number, or diastolic blood pressure, is the pressure reading when you stop hearing the patient's heartbeat. To take a palpated blood pressure, find the patient's pulse at the radial artery. Inflate the cuff until no pulse is present, then slowly release until a pulse returns. This is the systolic blood pressure. There is no way to palpate the diastolic blood pressure. Unlike pulse and respirations, blood pressure readings can vary wildly and still be healthy for any given patient. Asking the patient about their baseline blood pressure is usually the best way to determine whether their presentation is abnormal.
That's 104/60. Is that normal for you?
Pupils should be equal, round, and reactive to light. When a bright light is shone onto the eye, the pupil should visibly contract in response. Both pupils should contract evenly. If a patient is getting adequate perfusion to their extremities, their capillary refill should take under 2 seconds. This can be seen on the pad of a finger or nail bed. When checking skin signs, look for the coloration and the moisture of the patient's skin.
You feel normal temperature? All right.
Temperature may be taken orally or with a non-contact scanner. A patient's peripheral blood oxygen saturation, or SpO2, can be measured via a pulse oximeter, which is a photoelectric sensing probe that clips onto the patient's finger and measures the amount of red and infrared light being absorbed as blood flows through the capillary beds. It will report percentage SpO2 and pulse.